Then you move into muscle tests. So with the shoulder exam especially, you're going to be doing the same type of test many different times, and it depends on how long you're holding it and what you're looking for. So there is a little bit of redundancy with this, but you still have to at each stage test for what you're testing for. So with the muscle test, we're always going to be holding for 5 seconds, and you're going to be comparing bilaterally. So first with supraspinatus, so that's the empty can position, so thumb down, out in scaption. So you're going to meet my resistance here. Oh yeah. Carol brings up a really good point. You always want to test at the portion closest to the joint where you're testing. So I initially had my hand here, which involves the elbow, so we don't want to do that. So we want to move it into the actual arm so that we're then just testing the supraspinatus muscle and we're not involving anything else. So hold here, we go to the other side, we test. Then subscapularis, so it's the lift-off position, so you can stabilize, bring the arm out, meet my resistance here. Okay, and I'll just have you show the camera. So we're here, I'm stabilizing, and then I'm pulling the arm out towards me, and she's trying to resist that motion. And then Infraspinatus Minor, you can do it at the side, or you can do it in the Hawkins-Kennedy position. I personally like it this way, so meet my resistance here. 5, any pain with any of that? Nope, nope. Do the other side. Biceps and deltoid, we would have already tested during the first phase of the cervical part of the exam, so you do not have to test it here. If it was NAD, you can just mark off NAD. If there is something that is of note, so maybe it was 4 out of 5, or there was pain or whatnot, you can just write C-spine form, but that's only if it's abnormal. Don't write that down if it's just an NAD. For Pec Major Pec Minor, then you're going to have your patient laying supine. We're still going to have fresh face paper down. We're going to drape appropriately. This exam involves a lot of moving with your clipboard around the table. So if you're practicing, try and carry your clipboard with you so that you can get into the habit of always bringing that and your pen with you.
All right, Pec Major, we could either do the sternal or clavicular fibers, so just bring the arm up to 90 degrees, have the thumb pointing up towards the head, and with slight horizontal adduction.
So then you're going to stabilize at the opposite ASIS. You can ask your patient to point. So I'm testing Carol's left arm, so I'm standing on that side. My left arm is across stabilizing, and then I'm going to ask her to meet my resistance here while I'm trying to pull the arm out. So Carol, meet my resistance here. 5 seconds. Then I would walk around, test the other side. And then next is Pec Minor. So then,
I'll do this one.
Okay. So you would be standing on the same side as the patient, but for the camera, well, I'm standing on the opposite. So I would be stabilizing on, so bring the arm up, you can have the patient make a fist. All the motion is coming from the shoulder here. It's not so much about the arm itself, but you're going to be applying a downward pressure.
And you want them to lift the shoulder up off the table first.
Yeah, and then apply downward pressure to ask them to meet your resistance. So Carol, meet my resistance here. Great. You can also go across and stabilize, but you just want to make sure that you have a nice strong force through that arm. So if you have like one arm, that's wonky, so practice that one. And then for Serratus Interior, you're going to have them, you can do it one of 2 ways. You can have them seated and then have them here with their arm at 90 degree at the side, stabilizing, and you can have them push into your hand, so they're bringing their elbow back. Or you can bring them to the wall and have them do a standing push-off test so that you can see if there's any scapular winging.